All right, let's dive into something really important today, a serious condition called serotonin toxicity. Now, this can be a side effect of some of the most common medications out there, like antidepressants. And what we think we know about treating it, well, it might just be wrong.
So if you or anyone you know is on one of these medications, you're going to want to stick around for this. It turns out the common wisdom, the go-to treatment for this dangerous condition, might actually be a myth. And understanding what really saves lives is absolutely critical.
So what is serotonin toxicity at its core? Well, it's all about a chemical overload. Think of serotonin as a super important messenger in your brain. It helps manage everything from your mood to your sleep. Serotonin toxicity is what happens when that whole messaging system gets completely, utterly flooded.
To get a bit more technical, it's when way too much serotonin builds up in your central nervous system. The communication channels get so jammed with messages that the system basically starts to short circuit. And that kicks off a cascade of really serious physical and mental symptoms.
So how does this happen? Well, it usually comes down to one of three things: starting a new medication that affects serotonin or upping the dose, an accidental or intentional overdose, or mixing two different drugs that both boost serotonin levels. And get this isn't something that builds up slowly over weeks. For the majority of people, about 60%, the symptoms hit, and they hit fast, usually within just 6 hours.
Now here's something that's so important to understand. Serotonin toxicity isn't just one thing. It's not an on or off switch. It's a spectrum. It can start with something you might brush off as just a weird side effect, but it can quickly escalate into a life-threatening emergency. And this chart right here gives us a fantastic look at that very spectrum. It breaks down the whole progression from those early, milder symptoms all the way to severe, critical toxicity. Let's walk through these stages, because being able to recognize them is key to managing this properly.
Okay, so on the mild end of things, you might see symptoms like anxiety, maybe some really brisk reflexes, and a bump in blood pressure. The game plan here is pretty straightforward. You stop the medication that's causing the problem, and maybe use some sedatives like benzodiazepines to help with the symptoms.
But as we slide into moderate toxicity, things get a lot more alarming. Now we start seeing stuff like sustained clonus, that's a kind of rhythmic involuntary muscle spasm, plus real agitation, and the body's temperature starts to climb. At this point, you can see the treatment has to get more intensive.
And then you get to severe toxicity. This is a full-blown medical emergency. We're talking about extreme muscle rigidity, deep confusion or even delirium, and a dangerously high fever, usually over 39 degrees Celsius. This is the stage where lives are truly on the line.
So you might be thinking, okay, the symptoms seem pretty clear, especially when they're severe. What's the problem? Well, the dilemma, is that actually diagnosing serotonin toxicity can be incredibly tricky, especially in a patient who is already sick with something else.
And here's the absolute kicker. There is no lab test for this. No blood draw, no scan that can give you a simple yes or no. The diagnosis is based completely on a doctor's clinical judgment, looking at the patient's history and their symptoms.
Now, clinicians do have tools to help, like this one here, the Hunter criteria. It's basically a flowchart of symptoms to guide their thinking. But here's the hidden catch. This tool was developed by studying patients who had overdosed on these drugs.
And that is a huge deal. Why? Because if you take that same checklist and apply it to a critically ill patient, say someone in the ICU with a high heart rate and a fever from a bad infection, you could easily misdiagnose them with serotonin toxicity. It creates so much confusion and can send doctors down the completely wrong treatment path.
All of this diagnostic confusion leads us right to the main event, the central myth we're here to bust today. It's this idea that if we can just figure out the diagnosis, we can reach for a specific life-saving antidote.
I mean, it's the logical next question, right? If your brain is flooded with too much serotonin, there must be a drug that can block it and just fix everything.
And sure enough, there are drugs that are widely thought of as the antidotes. Medications like cyproheptadine, chlorpromazine, and olanzapine. They're all what we call serotonin antagonists, which means they're supposed to block those serotonin receptors. And they're often given with the hope that they'll reverse the whole process.
But here's the shocker. When you actually dig into the scientific evidence, a pretty stark picture emerges. The support for these so-called antidotes is just not there. It's incredibly weak, mostly based on animal studies or a handful of individual case reports, not the kind of big, solid human trials you need to prove they actually work.
And you don't have to take my word for it. This quote from the very paper we're basing this explainer on says it all. The authors state that the cornerstone of treating severe cases is not giving an antidote. It's all about providing effective, early, aggressive supportive care. That's the real key.
So, if it's not about the antidote, then what is it about? What actually saves a person's life when they're in the middle of a severe serotonin toxicity crisis? Let's break down the real priorities.
The focus isn't on finding some magic bullet to reverse the serotonin. No, the real goal is to keep the patient alive by aggressively fighting the two things that can actually kill them: that dangerously high body temperature, the hyperthermia, and the severe muscle rigidity that can stop them from breathing.
So, the real life-saving playbook looks like this. Step 1, stop any and all drugs that could be causing this immediately. Step 2, get aggressive with cooling. We're talking ice packs, cooling blankets, whatever it takes to bring that core temperature down. Step 3, use benzodiazepines to control the agitation. And finally, if that muscle rigidity gets so bad that it's interfering with breathing, you have to intubate and medically paralyze the patient. That lets a machine breathe for them and, crucially, stops their muscles from generating even more heat. See, it's these fundamental, supportive actions that make all the difference. That uncontrolled high temperature leads to muscle breakdown, which leads to kidney failure, and from there, it's a domino effect of multi-organ failure. Stopping that process dead in its tracks with fast, aggressive support is what saves the patient's life.
It's a pretty powerful lesson when you think about it, isn't it? In our endless search for clever antidotes and high-tech magic bullets, it's so easy to forget that the foundation of saving lives often comes down to just mastering the basics. It's a huge reminder that sometimes the most effective treatment isn't a single drug at all, but just a rapid, decisive, and aggressive focus on fundamental supportive care. Thanks for joining me for this one.